A new mom in Wisconsin will be celebrating this Mother's Day with a perspective like few others. She came close to losing her life during pregnancy, and now she is sharing her message of gratitude and trusting in that age-old wisdom called mother's intuition. NewsNation's Keleigh Beeson has the story. Every little coo.
There you go.
Every little cry.
Is it the bow?
We can take the bow off. We don't need to wear the bow.
Means the world to Susan Sigenthaler.
Boop, boop, boop.
After losing 4 babies to miscarriage, the 38-year-old reveled in her advancing pregnancy.
I loved every minute of it. I had a really good pregnancy, and it was right around 5 months where I'm like, are my feet supposed to be this puffy?
By the 7th month, Susan had a strange cough and was severely short of breath. Urgent care sent her home. An EKG done by Susan's midwife took her to the emergency room.
There were doctors all around me. And when they told me I was in heart failure, I didn't know what that meant. I didn't know if that meant I was dying, or it just didn't feel real.
She was on both IV medications as well as a device to support her, blood pressure and perfusion of her body.
Dr. Merrill Johnson explains the mother-to-be was on life support. Upon transfer to University Hospital in Madison, a team of doctors and nurses managed Susan's diagnosis, cardiomyopathy, all while monitoring her unborn baby.
It was very unusual, really, for our cardiothoracic surgical floor, our cardiac ICU floor, to have a little bassinet sitting outside someone's room.
Baby Stevie was born at 34 weeks by C-section, weighing just 3 pounds. But healthy. Without the physical stress of pregnancy, doctors were hoping mom's condition would improve. Instead, it was time for a transplant.
She was a status 2, which is the second highest status. The other thing that was helpful is that she was relatively small. She wasn't a huge person.
With Susan waiting for a new heart, Stevie grew strong enough to go home, alone with Dad Kyle.
It is sad. I feel like I missed those first, 4 to 8 weeks. I miss when she was that small because I didn't get to see her as much when she was first born.
Sadness soon gave way to relief as Susan got a new heart after 11 days on the transplant list.
The prednisone that you're on can cause some tissue to be deposited there.
At last, she could breathe deeply, start rehab, and bask in gratitude.
And every time I look at Stevie and my husband, I'll always be grateful. I never want to forget how grateful I was that first week coming out of the hospital.
For now, Susan bounces between making plans for how she'll thank her donor's family to tracking little Stevie's first teeth. After all, she's a transplant patient about to celebrate her very first Mother's Day.
Honestly, I don't even need anything. All I want to do is be with my husband and be with Stevie, and I'd be perfectly happy. I did ask for a full night's sleep, but that's all I really need, and then I'm good.
Thank you for watching. Go to newsnationnow.com to find NewsNation on your television provider, and don't forget to click the red subscribe button below to get more of NewsNation's fact-driven, unbiased coverage.